Hello, my name is Dr. Katie. How are you doing today? Okay, so you're coming in with some head problems, right? Okay, so I looked at your chart and you were having some of these problems a month ago. Has any of it improved or any of it changed or gotten worse? Okay, so it's gotten worse. Okay, and you said the pain was like a throbbing sensation and it happened most in the afternoon. Is that still accurate? Yes. Okay. First, let me verify your first and last name and your date of birth. Okay, that's correct. Did you have a hard time recalling that? Okay, it looked like you paused for a second there. No? Okay. Any memory problems or cognitive issues? No. Does it seem like in the last month it's been harder to recall things like names of relatives or things that you walked into a room to do and you don't remember what? Okay, that's good. Okay, so yes, last month I issued just a medical protocol of ibuprofen and resting, but it seems like you need a little bit more serious examination than that. So I'm going to do an in-depth cranial nerve exam today, okay? Okay, and that clicking and clacking in the background, that is our comfort animal. She wanders around as she pleases, so if you do hear a little clicking, she's our office dog, okay? So I'm going to ask you a series of questions about your family history of health, okay? Can you verify if anyone in your immediate family, grandparents, parents, 2 siblings and cousins have experienced any of the following conditions? So, lung disorders, blood disorders, migraines. Okay. So no one in your immediate family. Okay. Sometimes it's hard to know if a grandparent has had issues with migraines. Are you sure that they haven't, or you're just not that you're aware of? Okay, not that you're aware of. Okay. Okay, high blood pressure. Okay. And how long did that take place ago? Okay, is she still having those issues now? No hypertension. That's very good. Okay, what about metabolic problems? Okay, thyroid disorders. Good. Okay. Okay, any muscular problems? No. Bone problems such as osteoporosis? No. Okay. What about Alzheimer's, dementia? No. Okay, you're very young for that. So I don't think that's going to be a problem. Arthritis? Okay, so no degenerative issues that you're aware of. Okay, great. And on a scale of 1 to 10, I know last time you said the headaches were at about an 8, so have they increased? Okay, so what would they be at about now? Okay, and is it still in the afternoon or consistent throughout the day? Okay. All right, well, that is definitely an issue. Have you changed your diet at all? Okay, what about your caffeine intake? Why don't you describe that to me? Drink a lot of coffee. Well, many of us do. So how many cups a day would you say? 5 cups is a lot. Okay. I'm not going to say that that's the reason for your headaches because I don't know if that's true, but it definitely is contributing to the head pain. Yes. Okay. So it might make sense initially to drink more coffee to get rid of the head pain, but as the day goes on, it just kind of does the opposite. Okay, so that might be the reason why your headaches have gotten worse. But I'm going to go ahead and just check everything. It's time for a thorough examination anyway, so I'm glad that you came in, okay? Any questions for me? Okay. Okay. I'm just going to put on some gloves here. Okay. to start by listening to your heart and your lungs. So if you could just breathe normally for me, just stay right where you are. Make sure your legs are uncrossed. Very good. Okay. Heart rate sounds normal. Okay. Heartbeat is steady. I'm going to listen to your chest, so just continue to breathe normally. Good. Okay, so I'm going to flip it over and listen on the bounce side. Just continue to relax. Okay. Okay, so there's no S3 present. I can only hear S1 and S2, so no signs of a murmur. So that's very good. Okay. So next I'm going to listen to your blood pressure, okay? Okay, so do you mind if I use this arm right here? Okay, very good. So just hold that there. Okay. Okay. You're doing great. Okay, sorry, I squeezed you a little too hard there. Okay. That is 95/60, so your diastolic is a little low. Do you have any history of low blood pressure? Okay. Do you do aerobic exercise? Sometimes that can explain it. How often do you run? Okay, that's quite a lot. Okay. Do you ever feel dizzy standing up or sitting down? Okay, sometimes. And it might be due to the headaches. Okay, thank you for this information. It's definitely not in the danger zone, but it's a little bit lower than what we would like it to be. So, does your head ever feel hot or any fever-like symptoms? Okay, I'm just gonna take your temperature right now. That is 97.6, so that's perfect. Okay. And I'm going to take your oxygenation. So I'm going to have your index finger right here. Okay. Okay, perfect. So your heart rate is 80 beats per minute. Oxygenation is 99% at room air, which is excellent. So that definitely is attributed to aerobic exercise. Let me ask you, do your headaches go away when you run? Okay, so briefly afterwards. Okay. I'm going to next just palpate your head. Do you have any memory of falling at all? I know that this has been a while that you've had this going on, but in the last couple months before this all started, did you ever trip when you were running, fall down the stairs? Maybe you were out and having a lot of fun and don't remember? Okay. All right, that's good. Well, just let me know if anything comes up. You can be honest with me. I'm not here to judge. I'm really here to help you. Just try to stay really still for me. Okay, good. Okay. I'm not feeling any protrusions. Okay, nothing's coming up to me. I'm gonna go ahead and just go to the very tops of your head. Okay, and along the back. I'm just feeling for any kind of signs of concussion or contusions. Okay. Okay, so So do you feel any pain when I press here against the mastoid bone? No? Okay, I'm gonna come a little bit closer to the ears here. Any pain? Okay. Pain here? Okay. Whoops. Pain here. Pain here. All right, and any soreness again in the neck area? Okay. Any soreness radiating down to the shoulders that you've noticed? Numbness at all? Okay, perhaps a little bit of numbness. Okay, so I am seeing some slight edema of your face, so I'm going to do a few measurements just to make sure that we're symmetric here and within a normal range, that there's no swelling of one side of the face or other, okay? How are you feeling right now? Okay, it's pretty painful. So is the ibuprofen helping at all? Just a little, okay. Okay. So just hold your face still for me, just like that. Beautiful. Okay, that's 5 inches. 5.5. So a little bit of discrepancy here that I'm picking up on, especially affecting the right side. Okay, does it hurt more on one side of the head than the other? About the same, okay? Okay, continue to hold still for me, and thanks for being patient. Okay, that's 4 inches here. That's 2.5. That's 3, okay. So I'm seeing some swelling on the right side by a 1/2 inch. Measure. Okay. Okay, keep holding still for me. Okay. Okay. It's about even here. So I don't see any swelling of the cheeks or the lower cheeks. So that's good. Okay, just going to measure the bottom part of the face, so the chin to the ear. Okay, that's about 4.5. Okay. 4.5. Okay. Okay. So mostly even, but a little bit of swelling on that right side that I'm seeing. That might be your natural face shape, but I think that you might be having a bit of edema. Just a few more things. I just want to right here on the nose. Very good. Right here. It's about a 1/2 inch there. Okay, so 0.5 on each side. Okay. I just want to go ahead and grab the circumference of your head, so bear with me here. All right, that is 22. Okay. So just to have to keep track of, 22 inch circumference. Okay. Okay, just a few more pieces here. And that's there. Okay. All right. I'm going to do a series of tests now just to rule out some neurological disorders. So I'm going to place my glove right here above your eyebrow. When I tell you to raise your eyebrows, go ahead and try to raise them. If you can't, well, you can't, but you're going to go ahead and try. So in 3, 2, 1. Okay, try to furrow them for me like that. Just perfect. 3, 2, 1. Okay, normal. Raise your eyebrows for me. Did you have any difficulty doing that? Okay, good. Try to lower them in 3, 2, 1. Good. Now try to turn your head to the right or to the left. Sorry. My right, your left. 3, 2, 1. Okay, pain there. Okay, so in the neck. All right, that's interesting because you did mention that there wasn't any neck pain, but when you turn your head, so there might be something with your axis on the mastoid bone. Go ahead and turn again in 3, 2, 1. Okay, let's do the other way. 3, 2, 1. All right, so it was just on that left side. Okay. Well, your ability to turn was good. Your muscular reactions were strong. I'm just concerned about the pain that you had. Go ahead and try to look up at the ceiling for me. I'm going to put my hands right on your chin. 3, 2, 1. Try to look up. Okay, good. Now try to touch your chin to your chest in 3, 2, 1. Good. So I'm just placing my fingers right here. Try to look up at the ceiling for me in 3, 2, 1. Good. Okay. Was that very painful for you? Now look up for me. Try to look up at the ceiling. All right. Now try to touch your chin to your chest in 3, 2, 1. I'm going to resist your push. Okay. How was that? Okay. Give me a big smile. Okay. Now frown. All right. Very good. So any pain with your facial muscles? Any side of your face going tingly or numb at any point? Okay, I'm going to do a sharp or dull test just to judge and make sure that you're not having numbness, okay? Okay, and so this is going to be a dull sensation. Do you feel that as a tickle? Okay, and this will be sharp, so go ahead and say sharp or dull depending on which one you feel, okay? Good. Now close your eyes. Okay. Good. Yes. Yes. Mm-hmm. Good. Yes. Okay. Yes. Good. Keep your eyes closed. Okay, now focus on that left side. Okay. Okay. And so you're having some difficulties feeling the duller sensation. What about this? Okay. Good. All right, now just using the dull tool, I want you to tell me if what you're feeling is on your left or your right side, okay? Keep your eyes closed, breathe and relax. Okay. So that was neither. Okay. Okay. Okay, that was neither as well. Okay, I'm seeing that you're having a little bit of loss of sensitivity on that area where I noticed the edema. So that's definitely something to stay on top of. Okay. How's your sensation to temperature? Do you ever feel a wave of cold, especially on this right side of your face? No. Okay, any sudden hotness on one side of the face or even on both? So this is going to be a cold sensation. Close your eyes. Do you feel that? Okay, and this will be warm. Okay, this is a tiny little light that I use for different things, but it also is heated. Okay, so that will be warm. Do you feel the difference? Okay, keep those eyes closed. We're going to do a series of tests and say warm or cold. Good. Good. Yes. Okay. Good. Yes. Okay. Good. Okay. Yes. 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 Okay. Good. Yes. And right here. Okay, I'm not seeing any issues with temperature sensitivity, which is very good. Okay, I'm going to do a pressure point test, okay? So this is going to be one pressure point. This will be 2. Oh, this will be 2. Let me know if you feel one or two. Keep those eyes closed. Good. Okay. Okay. And were those two on your right side or the left side of your face? Good. Mm-hmm. Good. Yes. Yes. Mm-hmm. Good. Okay, excellent. Okay, so have you noticed any itching of the skin? Okay, try to hold still. I'm going to go ahead and see if your skin is perfused. I'm looking for signs of redness, itching. Okay. Scaly patches. Your skin looks pretty healthy to me. No issues here. Do you have any history of eczema, psoriasis? Okay, and which side of which your grandfather on? Maternal or paternal? Okay. But nothing with you? Okay. So that's not something I'm too worried about. I'm going to look with this magnifying glass. Just hold still. Okay. All right. I'm not seeing anything to be concerned with. No purpling of the skin. Okay. All right. I'm going to check your eyes and ears just as part of the cranial nerve exam, okay? So, have you been having any vision problems? No, that's good. I'm going to check your eyes. When was your last eye exam? Okay, it's been a couple years. Do you wear glasses or contacts? Okay, let me go ahead and take a look. Look straight ahead for me and do your best not to move your head. Okay. Okay, very good. Your pupils look round and reactive. I'm not seeing any issues with pupil dilation. Okay. No eye infections. And I don't see signs of redness. Jaundice of the eyes. Okay. Can you go ahead and blink a couple times? Blink 2 times? Okay, good. Do you ever get dry eyes? Okay. Okay, I'm continuing to look here. Same thing here. I'm seeing very healthy pupil, cornea. The whites of your eyes seem to be evenly distributed in terms of veinage. No bloodshot eyes. Okay. So I have a Snellen chart. I'm just going to do a quick vision test just to see. So, okay. So I'm going to hold this chart at about an arm's length distance. Okay. Can you go ahead and read this third row for me, starting with the F? Okay. Read it backwards. Good. What about this row, starting with the D? I'm reading it backwards with the S. Okay. The second to last one. Okay, so I'm seeing you squinting. Is there a strain in your eyes? Is it kind of hard to tell? So you shouldn't be squinting until you get at this very last row sometimes. But even then, it should be easy to read at this distance. So it might be time to look into getting some glasses or contacts. Can you read this row? So it does come with some difficulty. Have you been having any problems with street signs or just seeing things like words on the television if you're watching the news? Okay, all right. So start with here and then go backwards. So that one was pretty easy for you. Again. Okay, so you think this is the F? It's an E. It's an E. So it might be time just to get some, get an eye exam for sure, just to get a prescription, and I can give you a referral for that as well. What color is this? Good. What color is this? All right, you're not colorblind. So can you tell me which circle is larger, number 9 or number 7? Good, number 7 or number 5? Number 5 or number 2? Okay, good. All right. So I'm going to test your range of motion and just to make sure that both pupils are moving in congruency with one another. So I just want you to keep your head absolutely straight and just follow my fingers, okay? Okay. Any dizziness? Okay. I'm not seeing any issues there. Okay. So I'm going to bring my fingers into your field of vision. When you sense they're in your field of vision, when you see them from the corner of your eye, say now. Okay. Good. 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 And let me know which fingers are moving, the ones on your left or your right. Good. 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 Yes. Good. Good. Okay. Very good. So I'm not too worried about your eyes. I'm going to be looking inside your ears next. Okay. Okay. So go ahead and turn your head this way. I'm just going to be looking inside your ears. Okay, your tympanic membrane is pearl gray. Don't see any signs of scarring. All right, any hearing issues? Is it sometimes harder to hear sounds? Okay, go ahead and look the other way. Okay, same thing here. And you do not have a lot of wax buildup, so do you clean your ears regularly? Okay, I'm gonna have to commend you on that because they look very clean, sparkly, and like you have very good ear hygiene, so that's good. Let's see how they're working. Okay, so I'm going to make a little rustling sound. I want you to let me know which ear you hear the sound on, okay? Your left or your right? Close your eyes for me. Good. Good. Yes. Good. Yes. Good. Okay. All right. So there seems to be a music festival going on outside, so hopefully we can enjoy the music as we continue the exam, and then we can both go out and enjoy it together. So this is a tuning fork. Okay, I'm going to make a vibrational sensation near your ear. Let me know when the sensation stops. Good. 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 I'm still going to be placing it on different parts of your head as well. You're still going to kind of hear it. Let me know when it stops. Good. Let me know when it stops. Good. Let me know when it stops. Yes. Let me know when it stops. Yes. It stops. Okay. And which sound is louder, A or B? I'm going to give you two options, so tell me which one. This is A. This is B. Good. This is A. This is B. Very good. This is A. This is B. Good. This is B. This is A. All right. This is A. This is B. I promise I'm a doctor. I've done this before. Yes, but you got all those right. So next I'm going to be whispering some things in your ear. Let me know exactly what you hear, okay? Summertime. Holiday. Swings. Jump rope. Hopscotch. Computer files. Leaves. Birds. Mockingbird. Very good. Okay, our comfort animal is making some activity on the floor below, so hopefully we can both get past that. So everything looks good so far with your cranial nerves. I tested all 12. The only thing I'm seeing is that numbness and edema on that right side. Okay, so next just to wrap up the cranial nerve exam, I'm going to do a smell and taste test and then we'll be finished, okay? So I'm going to give you a few scents to smell. I want you to go ahead and tell me what they are. Okay, go ahead and close your eyes and inhale. These are all going to be pleasant. None are going to be jarring. What is that? Wood. Good. This is cedar. So, okay. This one's a little tricky. If you get it within the right kind of scent family, I'll let you pass. Go ahead and smell. Kind of like a musty, okay, darker smell. That's bergamot. It's one of my favorites. My sister says it smells like a trumpet. Okay, and we did cedar, sorry. Okay, this one, again, if you get it within the right scent family, you get it right. What does that smell like? Floral, yes, it is geranium. Very strong floral scent, so I'm glad that you have that right. Okay, and this last one is a little trickier, so do your best. Go ahead and inhale. What does that smell like to you? Frankincense, very good. I'm very surprised that you are that specific. Yes, because some of these are a little bit harder. Okay, we're going to do a scent test. So go ahead and open your mouth and close. What does that taste like to you? Good, and this should be very, very different. What is this? Salty. All right, I'm going to end on a good one, I promise. So go ahead and open and close, or close and open. All right, that was minty peppermint. Excellent. Okay, so this concludes our cranial nerve exam. I take your pain very seriously, and while I didn't see any neurological issues up front, I was very concerned with the edema that I saw. It's abnormal. Your blood pressure was a little bit lower than I'd liked, and you were having some loss of sensitivity on the right side where the edema was that I saw. I take your pain very seriously as well. Just you coming in and explaining to me that it is at this high of a level, this consistently is enough for me to go ahead and order a CT scan as well as an MRI, okay? So I'm going to send all the information to you over the portal. You're going to call and schedule it. I listed it as urgent, so you should be able to get in this week. Do you have any questions for me? There's no medication that I would even prescribe to you right now, given that the ibuprofen wouldn't work. I think this is an issue that we'll need to attack by looking at what's going on inside with your organs and your brain, okay? All right. Do you have any questions for me? Okay, I'm going to go ahead and see you next week for a follow-up at this time. Does that work for you? Okay, so you're going to go ahead and get that MRI and the CT scan, and we'll talk later, okay? Please feel better, relax, and know that we are going to get to the bottom of this and very soon. Okay? All right, bye.